Well, I really believe whole health is the future of the healthcare system in the United States and around the world. Having the Academic Consortium for Integrative Medicine and Health becoming a champion of whole health creates an incredible opportunity to transform the education of healthcare professionals, to create new clinical models of care, and to educate the public.
When we think about our current healthcare system, I like to quote Andrew Weil, who made it very clear that we don't have a health system, we have a disease care system. If you think about how our hospitals are set up, if you think about how we approach things as a society, we wait till things go bad and then we say, fix me. Everything is geared towards after the fact. What do we do now that things have gone awry? When in fact, what we really should be doing is thinking proactively.
I come to medicine from an Indian family raised in northeastern Ohio, where ideas of what a good life is span to what we eat, how we think, who we talk to, how we pray, and how we live our day-to-day lives. My beautiful grandmother was the catalyst for my family moving to the United States, a champion of the arts and women in professional fields. Unfortunately, she also suffered from type 2 diabetes, and she ended up passing away far before her time, I think we all feel, due to complications of this disease. And she passed away when I was 13 years old. Her passing was not due to lack of literacy or resources or the ability to care for herself, but rather because of a lack of a truly whole person, culturally humble approach to her care.
Our colleagues at the VA would tell us that whole health is asking somebody not what's the matter with you, but what matters to you. It flips the question on its head and really looks at a patient and says, you're not just a back injury or a chronic condition. You're a person who wants to dance with your grandkids and thrive in life. A somewhat common misperception is that integrative health means alternative health or complementary health. In reality, especially as the evidence base has evolved, it is integrating all evidence-based healthcare from various disciplines, healing systems, and therapeutic approaches. The Academic Consortium has been able to be a champion of building the evidence base that's needed to make system changes and policy changes.
There was a movement and there was a thirst and an eagerness to really report and learn about research in the field. By coming together, we were able to create a community. And so the consortium itself gave us the credibility to move forward. So we all supported each other. And so we became the credible voice around the globe, I should point out, of research in integrative medicine.
My grandmother's experience inspired me to become a physician and be the change I want to see in healthcare.
When I was introduced to Consortium at just 19 years old, I was met with a group of people who were visionaries, experts in their work, who lived their work, who meditated every day, who were willing to share their craft, but met that with the scientific rigor and the courage to go out and talk about this in spaces where it wasn't accepted or known before.
We're looking at the whole person to optimize their health. And we have to continue to be the voice. And the strength of this organization is in the institutions that form it.
We need those champions that are in our membership and are in the broader community to demonstrate how to do this.
It truly is a time for new ideas, new perspectives, new innovation. It really is time for whole health for the nation.